There is a consensus that Uganda's health sector is underfinanced and cannot deliver the national minimum health care package to all. To actualize the goals envisioned in the National Health Sector Development Plan and the Health Financing Strategy, the government of Uganda embarked on steps to introduce a national health insurance scheme as its major health financing reform towards the achievement of universal health coverage. Uganda and South Sudan remain the only countries in the East African community without a semblance of a national health insurance scheme. Ugandans are anxiously looking up to the government to finally have this insurance scheme in place. The National Health Insurance Scheme is one of the health financing mechanisms where individuals and households contribute in advance a prescribed amount of money, premium, to a fund holder who in turn purchases a defined package of services on behalf of the members from accredited health service providers. It is aimed at protecting individuals and households from catastrophic out-of-the-pocket health expenditure that is currently a big problem in Uganda, constraining the attainment of universal health coverage goals and slowing the process of human capital development. Uganda's journey to have a national health insurance scheme started way back in 1987. The journey has been very slow until recently in March 2021 in a landmark debate when Parliament of Uganda anonymously passed the bill that outlined the general structure for a first-ever national social health insurance scheme in Uganda. Unfortunately, it was not assented to by the President, who sent it back to the Minister of Health.
Uganda is aspiring, like all the countries, and we are committed, we have commitment to universal health coverage, which is not a dream. And this we have committed internationally by 2030. And national health insurance is not universal health coverage, but it's the biggest catalyst. It's not a magic bullet. But if you ensure your people's health, that people don't have to think twice, even if people don't go to hospital because they don't have money, or they die, or they are badly treated. So it's the biggest catalyst. National health insurance is the catalyst, the one big element that will help this country to achieve universal health coverage.
According to the information we got, I think the main issue was that the President was giving more time to the ministry to discuss and engage with the stakeholders who had not been satisfied with the version that Parliament passed. And we also know that the Minister of Health, during the passing, had also raised the same concerns, that there were some people who were still having issues. So the main group we know we had is that they were the manufacturers, the employers, who were thinking and arguing that the bill, as it had been passed, would increase the cost of doing business on their part. So this is what we know. Secondly, we also we know that according to the Speaker, the former Speaker, he had also ruled that those bills which had been presented to the President and the term of office of the previous Parliament expired before being assented to, they had become null and void. Therefore, he advised that all of them be referred back to be represented, tabled before Parliament. So that's all we know.
Uganda is now the only nation among the 5 East African countries that does not have a national health insurance scheme. The Minister of Health is engaging with different stakeholders to ensure that the National Health Insurance Bill is retabled in Parliament and passed again, with hopes that the President will this time round assent to it so that implementation gets underway. Dr. Charles Olaro is the Director of Clinical Services in the Ministry of Health.
We already had engagement with the members of Parliament, which they have been able to make their contributions. Today we are here, and we think we will still be able to engage even other groups. And then we shall incorporate the stakeholders' inputs in the National Health Insurance Bill 2022. and then submit it to the bill back to cabinet before it finally moves to parliament. But as all of you know historically, this is work which has gone beyond now over 2 decades. And all of us agree who are here that we need it. And even in its crudest form, look at it, even the worst case scenario, it will still be able to make a very big what? A very big difference.
The Commissioner Planning in the Ministry of Health, Dr. Sarah Byakika, is in agreement that the current financing for health is not ideal to deliver the minimum health care package to Ugandans.
So the question is insurance or not, whether we have insurance or not, because there's an assumption sometimes when you interact with the public or some stakeholders, especially the beneficiaries, they think that when we have the health insurance established, then government funding should stop. Some assumption that health insurance will solve all our health budget issues. That is not the case. With or without insurance, we are saying the public budget or the government of Uganda tax revenue contribution towards health services should continue increasing, because the out-of-pocket that we are tapping from through the health insurance scheme contributes to what other funding mechanisms we have. So health insurance alone you cannot generate adequate funding for health service delivery.
The Africa Regional Office of Partners in Population and Development, PPDRO, an intergovernmental alliance of 28 developing countries including Uganda, is collaborating with health-focused partners and stakeholders to advocate that Parliament and Government of Uganda enact a law of national health insurance as a strong catalyst for Uganda to achieve UHC. Achilles Chiwanuka is the program officer at the Africa Regional Office of PPDRO in Kampala.
The biggest role of government here is to regulate, to pass policy, to have this well, regulated and put in place. The first important thing that if I am calling out to government is to say, have this bill passed in Parliament and create a law, formulate whatever procedure they will take. I know that now the regulation has been and it had been passed. They will form an agency and people will align to that, something akin to National Social Security Fund or some people and individuals will contribute money to that fund. But this must be regulated by government.
When I lived in Kenya, they started their scheme in the 70s. And so it's not, it's really surprising that with all this time Uganda hasn't started. So you can see how long we have been on the journey.
But the concern by many stakeholders is the slow progress in having the National Health Insurance Scheme in place. The desk officer for the proposed National Health Insurance Scheme in the Department of Planning at the Ministry of Health, Mr. Ali Walimbwa, assures Ugandans that the country will very soon have a National Health Insurance Scheme.
Following the return of the National Health Insurance Scheme Act, and the reason being that time had elapsed for the old bills of the 10th Parliament, and if they found that bill had not been assented to, by law it was supposed to be returned. So it was returned, and what we're doing now is to make sure that it is resubmitted. And the status is we use that opportunity to make sure that if there are any things that were not very clear or not agreed upon in the previous bill that had been passed, we'll use it to make sure that it is cleared, and that's what we've been doing, getting to fine-tune the bill and make sure that everybody is on board so that it can be submitted. So that has been the process. There's a plan to make sure that the scheme can subsidize those that are completely unable to pay, but there are also proposals. So those details will come, but there are proposals of getting subsidies for certain categories of people, depending on what the parliament can approve. But we have all the proposals for everybody. Those who can afford something little, and those who cannot afford completely, if it's possible. But also there's an opportunity that if your grandmother is requested 10,000 and you can afford to pay for your grandmother, you can pay it here, and then she gets a card, she enjoys the same services like you. So that's also an opportunity.
The Executive Director, Uganda Health Federation, Ms. Grace Salichiwanuka, describes the National Health Insurance Scheme as a redeemer to the country's health sector, since it will better the delivery of healthcare services.
What we've done is we've been having engagements with the Ministry of Health. Uganda Healthcare Federation is part of the NHIS task force at the Ministry of Health. And these are the things that we've been advocating for. We have a lot of minutes and working documents that the Ministry of Health is looking at. We also have the Universal Health Coverage Roadmap that talks about this. We have the National Development Plan that all of them talk about how do you strengthen public-private partnership through investing in the health system and allowing the private sector access to affordable financing to be able to put up those factories. We've been having quite a number of engagements with banks and health financing and financing institutions in the country to say, how can we support these industries to be able to do more? Because once you do more locally as a country, the cost actually comes down.
The national health insurance is not a luxury, it's a necessity.
I feel we should start now. Because we are dying. Our own people are dying.
Uganda can live within means, its people can live within means, and the government can do whatever it can, when it can, and I think they can. When there is no insurance cover, then the cover has to be borne by those around you. The bill we are asking for will allow policies that help the people with this burden.
It guarantees life for our people and for our future generations. A healthy country will always develop.
I am tired of attending funeral services, and we say it has been God's will to take away this person. Death can be postponed.
The major objective of the National Health Insurance Scheme is to protect households and individuals from the catastrophic out-of-pocket health expenditure that is currently a big problem in Uganda, as Achilles Chiwanuka, the program officer at Partner for Population and Development, elaborates.
Out-of-pocket means that you are not insured. Your health is not insured. If you are sick, whether you have money or not, whether it's 1 million or 10, you want to survive, you either sell your land or your house or your property, or you borrow money from the bank, and this has happened, to be treated. Now, this is extremely catastrophic, and you have seen it happening here. That's the best way I can say why national health insurance, or health insurance.
An estimated 38.8% of Uganda's health expenditures are paid by individuals through out-of-pocket costs, followed by development partners 41%, government 16%, and insurance scheme 4%. This, therefore, necessitates the need for Uganda to have a national health insurance scheme, because it has the potential to pool resources from public, private and donor funding, including global health initiatives.
Our dear President, to really quicken the process of making this bill become a law.
What are they doing to save the lives of Ugandans? Yes, we want a good economy, but economy is going to be spearheaded by people who are living, not dead people. So life saving should be given priority.